I tried the 4-piece on one of my patients, and I actually got a good result because he didn't press the call bell within the 8 hours that I had him as a patient, because I was there asking him constantly every hour if he needed water, if he needed something for pain, or if his positioning is okay, or if he needs to go to the bathroom. So I think it really helps.
So every hour, the 4 specific questions that we ask are the 4 P's, and the first one is pain, and the second one would be potty, and then the third is placement, and the fourth proximity. So making sure that the patient has a glass of water, their glasses, dentures, all in range.
So the hourly check is a short-term statement, but it actually encompasses quite a few activities.
A patient who was dehydrated, his urine was really concentrated. So every hour I would go and offer him more water. Even though he didn't want to, he kept drinking more water, and actually the next day his urine output was increased from 200 to 1,000.
Oh wow.
Yeah, so he said you're nagging me just like my wife, but he still did it, and his wife was there, thank God, and she was able to help me.
How the families felt about it was that they felt that we're actually showing more interest in the patient, and we're popping in the rooms more often.
So especially some patients, they don't like to, they think it's a burden to ask a nurse something. So when you come in, we come into the room, we tell the patient that we have time now. You know, at least that will make them feel comfortable.
This started out as a nursing venture, and as we grew through this, well, we realized that the important thing was that the patient has contact with a care provider, and it's not just nursing that goes in there. We have a large interdisciplinary team, the social worker, the pharmacist, the dietitian. They might be going into the room at intervals that are external to what that nursing went in the room for. And we have come together and asked them to do the same thing when they are in the room, to use the same type of statements and not to leave the room without asking the frequency of the times that you're going in and checking in with the patient. And because of the questions that we're asking, it does affect your falls risk and results in less falls on your unit, because you are there with the patient, so you don't have those incident reports where patient reaching for a urinal.
Yes.
Because every hour we're going in there and making sure that the spatial component is looked after.
Every hour I go to my some of my patients, and I just ask for if the 4 B's, if they have pain, if they need to go to the bathroom, which is the personal need. And the third one will be the positioning, if they're comfortable, if they need to be repositioned, and how comfortable they are right now. And then the fourth one will be the placement of, let's say, do they need their table next to them, their call bell, and maybe the call light. And with that, I've noticed that the call bells are reduced, and also our fall risk is down right now.
I found the benefits of hourly rounds were reduced call bells, increases patient satisfaction, which reduces anxiety and builds more trust with the patient, and finally decreases the risk of falls.